Hey everyone, and welcome back to Zero Diabetes Zone. If you're living with diabetes, you know that managing your health while traveling requires some extra planning. And with travel picking up, it's more important than ever to stay updated on the latest TSA guidelines, especially when it comes to flying with your medications and supplies. That's why, in today's video, we're diving deep into the new TSA rules for traveling with medication in 2025. We'll cover everything you need to know to breeze through airport security without any hiccups, keeping your meds safe and accessible. So, grab your insulin, test strips, and let's get started. First, let's cover the basics. The good news is that the TSA generally allows you to bring medications, both prescription and over-the-counter, in your carry-on and checked baggage. Number 1. Carry-on versus checked baggage. It's always recommended to keep your essential diabetes medications and supplies like insulin, syringes, pumps, sensors, and blood glucose meters in your carry-on bag. Why? Because you don't want to risk losing them if your checked baggage gets delayed or lost. Plus, you need immediate access to them. Number 2. Notification is key. While not mandatory, it's always a good idea to inform the TSA officer that you have diabetes and are carrying related supplies. This can help streamline the screening process. Number 3. Documentation. While not always required, carrying a doctor's note or prescription for your medications can be helpful, especially for insulin or other controlled substances. This can prevent potential delays or questions. Now, let's talk specifics about some common diabetes-related items. Insulin. Insulin is considered a liquid medication and is exempt from the 3.4-ounce 100 milliliters limit. Make sure it's clearly labeled. Syringes and lancets. These are allowed with your insulin or other injectable medications. Again, keep them properly stored and consider having documentation. Insulin pumps and continuous glucose monitors CGMs. You can travel with these devices, but be aware that you might need to disconnect your pump temporarily during screening. It's crucial to check with the manufacturer of your device for specific guidance on airport security procedures, including whether it's safe to go through X-ray machines or body scanners. Okay, let's talk about some common mistakes people make when traveling with medication that can lead to headaches at airport security. Number 1. Unlabeled medications. Always keep your medications in their original, properly labeled containers. This helps TSA officers easily identify them. Number 2. Loose syringes or lancets. Make sure these are safely stored in a Sharps container or a dedicated travel case. Number 3. Ignoring temperature considerations. Insulin and some other medications need to be kept at specific temperatures. Use a travel cooler with ice packs to keep them stable. Number 4. Lack of planning. Don't wait until the last minute to pack your medications. Give yourself plenty of time to organize everything and gather any necessary documentation. So, how do you make the screening process as smooth as possible? Be prepared. Have your medications and supplies readily accessible. Inform the TSA officer, let them know you have diabetes and are carrying related supplies. Follow instructions, cooperate with the TSA officer and answer their questions honestly. If you have concerns about advanced imaging technology, request alternative screening. Let's recap the key takeaways. Keep essential medications in your carry-on. Label everything clearly. Consider bringing documentation. Be prepared to inform the TSA officer. And here's a bonus tip: check the TSA website for the most up-to-date information before your trip, as rules and regulations can change. That's it for today's video. I hope this helped you feel more prepared for traveling with your medications in 2025. If you found this video helpful, please give it a thumbs up. Subscribe to Zero Diabetes Zone for more diabetes management tips, and share it with your fellow travelers. Safe travels, everyone, and I'll see you in the next video.